Thank you, Mr. President. It's day 39. Day 39 of the government shutdown. Some of us are here working over the weekend. I want to thank all the staff, all the people who work here at the Capitol who are not getting paid. We genuinely appreciate your dedicated public service, putting your jobs and the country first. Thank you. I appreciate that. I know that there are a number of people across the country that are probably pretty peeved off today. There, we'll use that word. Pretty upset about how this government shutdown is affecting them. Sure, many of them got turned away at the airports, receiving emails, finding out that their flights are canceled, their plans for work, for family are canceled. And for what? A senseless government shutdown. I know that there are a lot of people who are struggling. They don't know when it's going to end. They haven't been paid in over a month. They have questions. The members of this body, we ask each other, well, when is this going to end? None of us know. Imagine the people out there across the country who have lives that they're trying to figure out. They have no idea when this is coming to an end. I feel for them. And then the people who struggle the most, people low income who don't know where their SNAP benefits stand, whether this will go on for another week or another 3 years, since it's about standing up to Donald Trump, however long that will take to, I guess, share that lesson. But 14 times I have voted, as have many of my colleagues, to keep the government open, solve this problem, move ahead. Soon, I believe we'll be having the opportunity to vote a 15th time. This one may be a little different. To extend a clean CR that would run till the end of January, along with perhaps some of the appropriations bills that have already passed this chamber on a bipartisan basis. Perhaps the 15th time we can convince 5 more of our Democrat colleagues to go along with us. But I always choose to be an optimist. I saw the minority leader on the floor earlier today. They, in their proposal, allegedly, even though we haven't seen the written, they say they have a clean CR. We have a clean CR. They don't have a clean CR but they have a clean CR with one exception. A demand, an impediment as it's become, of the extension of the Biden COVID bonuses. That is the difference between what we have offered and what they have offered. And really what it serves as, it has over the past 4 years, Democrats implemented this. They set the expiration date for 2025, but it was a COVID bonus. It was supposed to be temporary, but really what it was a bailout of a failed Obamacare system. But that's what they're holding out over. Let me tell you what that is, what that means, what's inside of it, why the American people should have concerns about it. Healthcare inflation in this country is double of what consumer inflation has been since Obamacare got enacted. In the 21st century, healthcare is the #1 driver of inflation in this country. So I hope we want to get at the cost and the cause of what's affecting the unaffordability of healthcare in this country. Healthcare has increased since Obamacare started by 6% a year, while overall inflation has been 3% or less. But I want to dig in a little bit over the impediment of the Biden COVID bonuses. First of all, the way they're structured, there is massive fraud. With 0 premiums and an incentive, because the money goes directly to the insurance companies, is to sign up people, phantom enrollees. No one knows who they are, where they are. The premiums go right to the insurance companies, not to the individual. And what has that done for insurance companies? Well, you can see here. This is what Obamacare and then the COVID bonuses have done for the insurance companies. Record profits. Record profits. During this period, while we've seen the stock performance of health insurance companies go up by 600%, the Dow Jones Industrial has gone up by 300%. Double. Insurance companies have double what the rest of the American economy has done. The other part of these subsidies that are problematic is that there are no income caps. We're not targeting these resources at people who are struggling to pay. We're giving them to everyone that wants them. So I've listened to my colleagues, the gentleman, chairman of our HELP committee, Dr. Cassidy. He's talked about this at length. I've heard others talk about that there is a bipartisan way to do this. There is a thoughtful way to make sure that these efforts are focused on consumers and not on the insurance companies. So there are valid disagreements and substantive disagreements about why the Biden COVID bonuses are bad. But that absolves nobody, no one, of the responsibility to continue to work on resolving the inflationary costs of health care to the American consumer that have come since Obamacare was implemented. I wasn't here for it. I have no pride in ownership, but I do want to fix it. I didn't create the problem, but I do care about making sure that people can afford health care. I want that to happen. I want to make sure that everybody has access to good, solid health care coverage. And we can do that, but we don't need to shut down government to keep working on it. And that's the point. We both have proposed clean CRs. Take out the stuff that we disagree on, keep working on it. Pay the American people, pay the people who work here, get the flights going, and then let's get back to work on doing what we should have been doing for the last 39 days, is having some constructive discussions about how we fix Obamacare, how we drive down the cost of health care in this country, and how we make it affordable again for the American people. We'll have that chance here over the weekend. I hope we'll take advantage of it. I hope we'll reopen the government and begin serving the American people while we continue the very important conversation of how we eliminate the fraud, of how we make health care more affordable. Mr. President, I yield.